I am Ruth Riley, and I am a medical librarian. I work at the University of South Carolina School of Medicine, and I've worked here 20 years. And I'm originally from Kansas, but I feel like South Carolina is my home now. In August of 2019, I all of a sudden felt some little stabbing pain in my breast, and I realized that I should go check and see when I was due for my mammogram. And as it turned out, I was 2 months past the date when I was supposed to have had my mammogram. I immediately got scheduled, and they found a mass and did a biopsy, and it turned out it was cancerous. It had actually gone to my lymph nodes, so that made it stage 2 cancer. I was then connected with Dr. Julian Kim for my surgeon. He recommended that I have a single mastectomy. When Dr. Kim and I were talking about the surgery plans, he asked me if I would be willing to have them use this new technology that they had never used before at Prisma Health called the Magseed technology. And he had already used it at Cleveland Clinic before.
Magseed is a device that can help the surgeon detect the area of cancer during surgery, even if they can't feel it. Traditionally, we would use wires that are placed through the skin to find these areas during surgery, but we're using a new technology where a small magnetic seed is placed at the area of interest, and then during surgery, you can use a handheld probe to actually identify the area that has to be removed. This procedure is not available at other institutions here. We are the first to employ this.
It's much less stressful for the woman because it's just one procedure to put that little seed in there. And in my case, they did it the day of the surgery because they'd never done it before. In the future, he said, for other women, they could actually have the seed implanted 2 or 3 days before the surgery, so you wouldn't even have to be dealing with that the morning of the surgery. When the doctor came to my room to talk to me after the surgery, it was not too long after that, I asked her, did the Magseed technology work? And she said, yes, it worked beautifully. They were able to identify the cancerous tissue and get it out. And she said they were really happy with how it went. And I was really glad that I had done it and that hopefully have other surgeons use it in future surgeries.
Ruth recovered very well from the surgical procedure because it did not involve using a wire. In addition, Ruth was quite important in terms of she was the first patient to volunteer to try out this new procedure, and it worked quite well, and now we are happy to report that we are expanding this procedure to other similar patients.
When you go to a hospital connected to a medical school, you get that advantage of having doctors who stay on top of research, stay on top of new technologies, because they're teaching residents, they're teaching medical students, so they really have to stay on top of everything. And to me, that is a huge benefit of having Prisma Health Richland in Columbia. If I had to describe my overall experience at Prisma Health, I would say it was top-notch. It was A+. I couldn't have asked for better caregivers in terms of their expertise and their knowledge, but also their kindness and their compassion for the whole process.